When you were younger, did you have a lot of ear infections? Your parents may have taken you to a special type of doctor called an otolaryngologist, or ENT doctor as they're commonly known. That's probably because it's easier to say. As Gracie learned when Dr. Roger Shea took the time from his busy day to talk with her, ENT doctors not only work with ear problems, but also problems patients have with other areas of their face, neck, and head.
We're here with Dr. Shea. Dr. Shea, you're an otolaryngologist. What does that mean?
Well, oto for ear, laryn for the larynx, and gology is the study of. So it's really a study of the, in essence, the study of the ear, nose, and throat.
What does your specialty cover?
Our specialty is very vast. Although I am an otolaryngologist, there are subspecialties within our specialty that deal just with ear surgery, voice box surgery, sinus, plastic surgery, and allergy. And so you can, in that specialty, you can pick where you want to go. And pediatrics, which is what I do day to day. I do general otolaryngology, but with an emphasis on pediatrics. And so I see all the little kids between, let's say, newborns in the NICU who have breathing problems, but the most common child to come in is between 18 months and 5 years old that have either ears problems because of ear infections, tonsil problems because they're too big, or throat problems because they have too many infections.
So what type of schooling do you need for this?
Well, just as every other medical doctor needs, they have to go through 4 years of undergraduate and then apply to medical school. And then you go through medical school with a 4-year degree. And then otolaryngology requires a 1 year of general internship in general surgery, and then 4 to 5 years of general otolaryngology, and then a subspecialty that can either be 1 or 2 years.
Do you do surgeries as well?
Yes. Yes, we are a specialty who does half of their practice or 3/4 of their practice can be in the office, and the other part can be in the operating room. You can be a head and neck surgeon and be in the operating room all the time. You could be an allergist and stay in the office all the time. You could be actually one thing I didn't mention, in plastic surgery, you could be a Mohs surgeon who just does these delicate little surgeries removing cancers from the skin and be in the office. So you can be a hospitalist or an office-based practice.
Did you always want to become a doctor?
I don't think so. I didn't know, because my favorite thing was marine biology. So that was what a lot of kids dream of being when they're a kid. But when I entered college as a biology major, all my classmates were bio majors, but they were pre-med. But there's nothing that differentiated them from me in the first 4 years. It's only what they were able to apply for after. So I went through the program with them and kind of saw that being a marine biologist may not take care of all the needs I had. And not that I took it for because of the career change. It was something, I started looking into, and it seemed very interesting. And I said, well, I'm going to go give it a try, So it wasn't something I had planned my whole life.
Why did you choose to be an ENT?
Well, I think I wanted a specialty that I could operate, because I'm a mechanical guy. I'm very mechanical, at least I think I am. And I wanted something I could work with my hands. And when you get exposed to general surgery and the other things, you kind of see what you like and you don't like, and you kind of go from there. But I liked working in the ear. I liked microscopic surgery. I liked, it was an area that just interested me from the day I saw it.
Now, medicine is a very competitive field when it comes to getting into med school. Do you have any suggestions or advice for someone?
Don't give up. You can always get in. I guarantee that. There are many different ways to get in. You could, if you have to, you can, I trained in the United States completely, but many people who are practicing today, who started their careers outside the United States, studied hard, did well on the entrance exams, and then came back in. There are certain states that allow only state residents in. And if you happen to live in that state, your chances of getting into a school are greatly increased. The military offers roads to medical school. So if you are dedicated and you know that's what you want to be, and you work hard enough, even though you don't think you're smart enough, I think you can get in.
That's great. Thank you so much for sharing about life as an ENT and med school and everything. I really appreciate it.
You're very welcome. Nice meeting you.
If you think you're interested in being an ENT doctor, read up on the profession and see if you can talk to a specialist in your area. The path to being an ENT doctor is not an easy one. However, think how rewarding it would be to help patients feel better by not only treating problems in their face, neck, and head, but also improving the appearance of these areas.
It's time to take a break.